You're listening to Where Before Meets After.
Hi, my name is Ty. I work at MD Beauty Lab with Portland Plastic Surgery Group, and I am a aesthetic nurse here.
Is there a limit to how much filler you can get in a day? Like, can you do lips and wrinkles and other things all at once? Or
Oh,
is
yeah.
it better to, yeah.
I mean, how many times do you want to get poked in a day? But if you're doing lips, you can do all the other, any area surrounding cheeks, chin, jawline. There's no restriction there. But within lips, I would say I typically don't do anything more than a 1 milliliter syringe at a time for a patient.
When would you do more than 1 milliliter in the lips?
And one time, never, probably. I
Never.
would say never. Yeah.
Yeah.
If somebody wanted more, like a few months from their treatment, then I, would reassess and talk to them about my concerns with migration, because I think that would be the biggest concern once we go past 1 milliliter.
Where does it migrate to?
Past your lip. So above your lip, underneath. Over time, if somebody's been doing lips, having their lips done for a long time, and they just, they're doing like every 9 months coming in, I think it's kind of almost inevitable, and it will happen over time. But, if you're going slow, doing a small amount, it's less likely.
Is it reversible?
Filler, yeah. And that's, I think, one of the biggest things, that if you're going anywhere to get filler, lip filler, any type of filler done, you want to make sure that the place that you're going to has Hylenex or hyaluronidase for safety reasons above all. Because if something were to happen, you do get an occlusion in a blood vessel, we would need to use that immediately.
And I think your point about asking wherever you go to get injections, asking what their procedure is and if they're prepared for that is a really important question. Are there other things that you do at MD Beauty Lab for safety?
I think just doing continuing education, knowing your anatomy, really assessing the patient. Everyone's different. Mm-hmm. Blood vessels, you could look at a drawing and say, oh, this is where a really big blood vessel should be running through here. But you're really assessing the patient's looking at their lips. Sometimes you can see some vessels, if you pull their lip out and take a look, try to avoid as much as you can. I mean, bruising is very common with lip filler, and that's not anything to be afraid of. And the nice thing is we do have 4 plastic surgeons here in our office. So if, when we need help, we can always run to one of them and ask them. And I know as a fellow provider, they will be there willing to help us. So that's a great thing to have.
There aren't that many med spas in the Portland area that are attached to plastic surgery offices. And you're one of the one and only. And I think you might be the only one downtown, actually. If I'm interested in coming for a consult with you, where should I go online? How should I reach out?
Yeah, you just look up MD Beauty Lab. Our website will pop up. You can click on that. There should be our phone number listed. Give us a call. You can also, there is a section to fill out a contact us. And then when you fill that out, somebody from our office will receive that and then give you a call.
Where are you on Instagram?
My Instagram handle is Ty Aesthetics PDX.
Thanks for listening. I'm your host, Eva Shea. Follow the show and submit questions for our experts at wherebeforemeetsafter.com. Where Before Meets After is a production of The Axis.